Morning, Congressman, welcome back to York's Morning News. A pleasure to have you, sir.
Thanks, Pete. I'm really glad to be on with both of you. Thank you.
Well, we love having you on, and last week you had said, well, let's do it again this week, and we thought, great idea, so you are kind of we saved the best for last here this week, so to speak, okay? You know, last week we ended, Congressman, and I said to you, one of the problems that we have is we don't trust you, you being the government in general, not you specifically, obviously, but you're part of that whole thing right now. And as you go around to town hall meetings, and you do the touching of the pulse here around Pennsylvania, as I know you have to all 67 counties, how do you answer people when they come back? I'm sure in some incarnation they have said that to you in some way, shape, or form. How do you answer that right now? Because that seems to be the big monkey on the back.
Yeah, I take it straight on. I say, look, I think you're right. I got out of the U.S. military 3.5 years ago and ran for Congress.
Right.
And I shared your belief, and I honestly rightness about that government has not been accountable. Look, this recession we are in actually occurred because government was asleep at the switch and actually passed a law in 1999 that said there'd be no referee on the football field for derivatives up in Wall Street. And even though they were lending and loaning out of derivatives, like banks, they refused to set a reserve on the side of derivatives. And no one had to report how many. And because of that, the mortgage-backed securities went down the tubes and the economy savaged Americans. And so you look down at Washington, D.C., and you're right. And so how I answer it is this. I joined the U.S. military during the Vietnam War in 1970. The military was ranked 15 out of 15 that year in terms of public respect. It was the Vietnam War. We didn't deserve it, but it was that way. When I left 3.5 years ago, we were number one at 78% confidence factor. I want to be part of the team that returns accountability to Washington, D.C. It's why I came back on your show. I told you I would.
Right.
And if people keep their word about principle rather than political calculation on their job and trying to hold on to Washington, maybe we can regain their respect. But that's what a lot of this anxiety is about, in my opinion.
Congressman, we certainly applaud your principled stance on that, but I have to ask you the specific question of, okay, that's all well and good, but how are you as one person going to do that?
I'm going to do it by how I did it in my district. We kept our constituency office, where they have the closest touch to my constituents, open 7 days a week. Look, either of you call my office tonight at 9 o'clock Friday, someone will answer the phone. Call me afternoon time on Sunday to 9 o'clock on Sunday, answer the phone. So we handle 3 times at 10,000 the number of constituency cases than any other constituency office in America. And so we began to instill confidence that government would be there when we needed them. And if you say Democrat or Republican in that office, you're asked to leave. And so, I mean, pure and frank,
yeah.
When we literally work 7 days a week. Why? We're in the middle of a war. 2 overseas and 1 here at home. Look, that may sound small, but it isn't. I can't tell you how many times I go around and there'll be a Republican who says, you know, I may not be voting for you, but I want to thank you for helping me with my Medicare problem.
Yeah.
And that's the greatest. And I know people say, but it's when they turn to government and government doesn't listen or government doesn't explain. Look, we are in an echo chamber down there. We talk among ourselves. My town halls, I had 7 town halls prior to this summer on health care over the last year and a half, year and 3/4, because I believe that's what we should do. We had 38 summits in my district the first 2 years explaining things from education to other areas. I know that smells like small potatoes, but it isn't. Not in my district, and everybody doesn't agree with me. At least they know where I stand, and that's what I intend to do as a senator.
Let me ask,
everywhere, and like I told you, be back on your show.
Well, and we love having you on. You know that, and we have principled arguments here. We have principled debate here. We want to hear people and why they believe what they believe, and agree on some things and disagree on others. And maybe the idea at the end is to come up with the best idea. You know, one of the things that's happened in this country, Congressman, I'm going to ask you a question here that kind of is a general question, but I think you will have seen it. In fact, I know you will have seen it. We have a day and age here where many people out there, and I think this is what's driving an awful lot of the angst and the passion in this country. Many people who feel that America was made up of independent, rugged, individualistic, blue-collar kind of mentality are saying, where did we get the idea that we take from the rich, to give to the poor? Where do we get the idea that we are going to be a nation that worries more about the dependent than also helping to let the independent operate the way it has always operated? When did we get to that point where we talk about the minority all the time as opposed to the majority that helped to get us to a position of being responsible? When did we get to a point where we said we're going to take care of the dependent and somehow use the independent as the tree that never stops giving money and never stops giving help, and they're forced to do so by the government? Where did we get to that point?
Well, you see, I believe we've got to get to that point of taking care of the working family and the middle class. But let me tell you, the last 8 years did do the opposite, but in a little different way than you presented it, I think. Of the Bush tax cuts that our inspector voted for every time, 53% of all the tax cuts went to the top 1% of wage earners, the millionaires. 53% of the tax cuts. Now, when you sit back and you look at what happened, I voted twice and sent it to the Senate, where our inspector and everyone there sat on it, to cut out the tax benefits that hedge fund managers get. They're the billionaires, where their money is not in the hedge fund, so they don't get capital gains. They shouldn't at 15%. Yet the commissions they get by the loophole in the law gives them only 15% tax bracket for their wages. Their wages, not their money's in the name of the capital tax. Well, you know their secretary has to be taxed at 22 or 25%. We voted to cut that out. And you know what? It sat in the Senate. And because my belief is we've been rewarding those who benefit from the economy, not the engine of the economy, the middle and working class.
Well, but
I'm trying to change that to tax cuts for the middle class.
But here's the problem that we get into. Okay, first of all, I agree with you that there need to be some changes in the tax laws there to make them more equitable. But by the same token, you talked about people that come into your office, don't say Democrat or Republican, you're going to get tossed out. How about this idea of class warfare that's constantly created, and the idea that somehow, if you make it in this country, you are now somehow, in some way, shape, or form, the bad guy. And that is what is being painted here. And we talk about, okay, people under $250,000, you're not going to see any tax. Well, you are seeing tax and tobacco taxes and all those kind of things, and that's just as much a tax on the middle class as anything. But at the same time, you also see small business people now who are getting drilled by things like Medicare, and that's a government-operated program, who are getting drilled by all kinds of government mandates. And where is this effort that you talk about to get it off the backs of the middle class? Because those people are as middle class as anybody out there, and yet they're deemed as somehow rich, and they are the demons, and yet the administration and other people, other politicos out there say, no, that's not the case. It is the case. We're seeing it in real dollars.
Well, let's look at two facts, because I believe in facts. You know,
so do I.
The Bush administration came into office, they inherited a $4.5 trillion debt. Because of their tax policies, more than half of it going to the very, very rich, we now, before he left office, had a $10 trillion debt. Now, we've got to do something about that. So, yes, you're right. When you pivot a little bit and you say, wait a moment here, we have a health care plan that we're going to do. Mm-hmm. We know small businesses, by the Commonwealth Fund study, small businesses in Pennsylvania pay 18% more for their health care on average than big employers because they can't spread the risk.
That's right.
So we say, guess what, small businesses? We're going to help you out. We're going to let your employees go into this this health insurance exchange, of which one option, which is a choice, is a public health care plan option, and you can put your people in any private, which they choose, plan, or that public one, and your costs are going to be spread, so you no longer have to pay that 18% more than Boeing, a large corporation, or IBM. So first off, we're trying to alleviate for small business. Now, it's true. We say we need some revenues to pay for some of the program, okay? Now so we say, wait a moment. We know that we helped the very rich in the past 8 years under Bush by giving them 50% of all tax cuts. So we're saying, the middle class didn't get that. So why don't we let the middle class be helped out by relieving those small business owners 18% of their costs? But you got to help make the system work a little bit. So we take a little bit of money from the top, the ones who have benefited the last 8 years, to help pay for it. Now, mind you, those are the ones that have profited over the last 8 years. Now, is that class warfare or not? You have to ask yourself. They sure made out with 50% of the tax cuts the last 8 years. We're relieving the middle class, the small businesses of 18% of their health care costs. Now, we have to get a little bit of money for that, and where do we go? We go to those who benefited somewhat the last 8 years. Is that just going back to equality, or is that class warfare? Because I believe that when the very well-to-do made out, they made out. But all of a sudden, you're trying to balance it to help small businesses, and it's class warfare.
And yet we have a 26% corporation tax we pay in this country right now. It's driving a lot of business overseas. Here's the point I guess I want to say. Shall we then also alleviate that top 1% or top 5%, whatever you want to use, who pay what percentage of the taxes in this country? Shall we alleviate them of that burden as well? You know, let's bring that down as well, because they're paying the taxes right now, aren't they? Come on.
I want to make sure I understood your question.
Well, no, but what I'm saying is, if the top 1 to 5% are paying the great majority of taxes in this country, we've got 40% of the people or so in this country who pay no tax liability. Should we then maybe even it up for them at the bottom as well as at the top? In other words, take less of a tax liability at the top and get those people who aren't paying any tax liability. Let's change the tax laws to make them have to pay something.
Well, here's my belief, and I could be wrong, but my belief is everybody wants to be a millionaire. I mean, at least I joined the military, and I still thought I might take it someday.
We got you, yeah.
Okay, but I don't believe anybody wants to be a millionaire in Russia. They want to be a millionaire in America, where there's the opportunity, not the requirement, that all boats will rise around you and the whole social community does pretty well. Nobody wants to be hunkered down as a millionaire in a state with guards around and it isn't safe outside.
Where they spread the wealth and that kind of thing in Russia, yeah.
Yeah, so my belief is this, is that if there are those that are, for whatever reason, all right, are disenfranchised, they've lost their job, of which now we've had, close to 10 million Americans lose their job in the last year and a half through no fault of their own, but because Congress forbade any oversight of derivatives and the multimillionaires running them in New York City, all of a sudden 10 million Americans are throwing out. Now, they don't have a job. Should we tax them?
Yeah. Well,
and so my thing comes back to why it sounds nice to hear that statement that you made, and I understand the passion behind it. When you look at the reality,
I'm saying it more tongue. No. I'm saying it more tongue in cheek. My point is, we want to go after those who continue to do well in this country, and say, well, just a little bit of your wealth. You'd made it so a little bit of your wealth right now to make it even. It sounds like reparations talk to me. I guess that's where I get down to. Hey, Congressman, we're right at the end of a break here. Can you stick with us for a few minutes?
Absolutely. I'm going into Children's Hospital to talk about pediatric support for hospitals, and so I got about 10 more minutes. Is that
about
okay?
10 minutes. We got a quick break here. We'll come back. We got 2 calls to get into you, and then we'll get you into pediatric hospital. Okay?
Thank you.
Appreciate it. Thank you so much, Congressman. As usual, we take him over time, but he's as gracious as always, and we appreciate that. WSBA News Time, 8:25. WSBA News Time is 8:37. Very quick moment here with Congressman Joe Sestak, and we have Bob in Spring Grove. Bob, it's your turn to make the call with Congressman Sestak. Go ahead, Bob.
Good morning. Thank you for taking my call.
Thank you.
Much of the conversation right now in the country is about health care. And there's a lot of misinformation out there, like they're going to pull the plug on Granny. Illegal immigrants will be included in the health care bill, and they're going to do away with Medicare. And I was wondering what Congressman Sestak is going to do and what people who are in favor of health care reform should do to fight this misinformation and these fear tactics that are being used to discredit the health care reform bill.
All right, Bob. Thank you for your question. Congressman?
Yes, Bob, thank you. I will continue to do what I have been doing. I actually had the first town hall in all of America on health care after the recess. It was the morning after we got out at 10 a.m. at Bernabaro High School, my district. I've done 3 large ones so far, and I've got 3 more to do before we go back, large ones. But today I will be on a radio show or TV show 6 times talking about health care. And I'm even going on one, believe it or not, in California who asked me to come on. But the others are all here in Pennsylvania, from the Bob Rovner show to Bala Kinwood, etc. I am going to do exactly what you have asked. Continue to put out the facts and let people determine it on that. And I agree that if you didn't quite say it this way, but every representative should be out there every day making it clear on the facts.
And let's make sure also that you're giving us the facts, you as representatives, and that you aren't giving us misinformation. I think that's an important thing, too. And the idea that you're not also, and this is where I think the problem is right now for some Americans, the president talks about a public option, but he never goes beyond that. He doesn't say this is what will happen with it. He just simply says it is an option. It's just one option, but he never really explains it. And I think you have a responsibility as the government to explain that. You would agree with me, I'm sure.
I agree. I have to agree with what you just said. I'm sitting outside Children's Hospital here.
And I want to get you in there, by the way.
And the thing is, I will be talking about pediatric care within the health care plan option and all. And this isn't one of those 6 I talked about on radio and everything. But we've advertised it for people to come. It's just to make a point about pediatric care within this. Because eventually, if this plan works, I'm going to say S-CHIP for children should disappear because everybody is mandated to be covered in the overall health reform that we've done in a private plan or in a public plan. If I could, and the reason this is important, let's just take my daughter with brain cancer.
Yes.
She, at 18, and I'll be quite honest, when I left the military, I knew I was going to have to try to make some money, I thought, because she wouldn't be able to get a health care plan probably at 18 once I couldn't cover any longer because of pre-existing condition. But I decided to get into politics anyway because I needed to pay back for military pay. But now health care. But now it's mandated that no one can be denied a health care plan, private or that public care option for a pre-existing condition. That's a massive reform. And I want to bring that out because so many children end up with pre-existing conditions, but when they get 18, sometimes they either have to pay a heck of a lot more for a health care plan or they're denied it because of that. And that's one of the changes of facts I'm going to get out this morning.
Let me get one final call and get you in there. And by the way, you can blame the evil talk show host for keeping you late here. I know you won't do that. But Jim in Brownstown, final call here with Congressman Joe Sestak. Make it quick, Jim. Go ahead.
Thank you for the opportunity, guys. Congressman, how many Americans in the United States does not have insurance?
There are about 40 million American citizens who do not have health care insurance, of which probably about a fifth of them could readily afford it. Usually they're what I call masters of the universe.
Actually, there's a number out that says 60% could afford them on a recent study that just came out.
That may be. There are many who pretend. But now when you say afford it, what you have to say is how much. The ones I'm focused on primarily are the ones who make $50,000 or $60,000 or more, but they're very young and they don't want to. They'd rather have a night in the town in Philadelphia than pay for it. The problem with that, however, is when they go into emergency room, because they do get sick at times, the cost is borne. The more expensive cost of being acutely ill is borne by the hospital. No, it's not. It goes to the insurance company as overhead for the plans that you and I take on. So you and I pay, if we're single, $400 more for a private health care plan to cover the uninsured, whether they can or can't pay for it. If you're married and family has 2 children with a health care plan, you pay $1,100 for the uninsured.
Right.
That's why it should be like car insurance. I want that other guy to have car insurance, so if he hits me, he has an insurance company that can pay for the repair of my car. And so that's all we're saying is, no. Everybody has to be covered because I'm tired of paying for you uninsured if you can afford it for not. Well, and, by the way, those that can't afford it, we pay for when they're more acutely ill in the hospital. I'd rather pay up front for it when they're not acutely ill and get them preventive care and we pay less.
Congressman,
that's the concept.
We appreciate you joining us this morning. And
thank you so much.
As always, and please get into your meeting there. I know you've got a busy day in front of you. We appreciate you taking the time to be with us here on WSBA.
Glad to be back again. Take care, guys.
Always a pleasure, Congressman. Have a great day and a great weekend.
Welcome here.
Take care. Congressman Joe Sestak with us this morning on WSBA.